Hi, my name is Ivar Daxon and I am a student of the International Academy of Osteopathy. In this video I want to present my study, which name is Effects of Osteopathic Visceral Treatment of the Bladder and the Rectum in Patients with Restricted Internal Rotation Mobility of the Hip. This is my summary of this video presentation. I want to talk about the background and the objective of the study, material and methods of the study, the results, discussions, and the conclusions. The motivation of the author of the study is that the author himself has had a long period of time where he was dealing with hip-related injuries. During his football career, there were a lot of times where he was out due to those injuries, and those injuries were one of the factors why the author of the study stopped playing professionally. There are a lot of people around the world that have hip-related problems, people in all ages. When the hip is injured, often you see that the hip externally rotates, and the external rotators of the hip, especially obturator internus muscles and the piriformis muscles, contracts. Those muscles have fascial relations to the pelvic organs of the body, namely the bladder and the rectum. Us osteopaths often treat those visceral relations to the hip restrictions, and the author of the study often sees that people that have external rotation lesions of the hip also often have visceral problems in the bladder or the rectum. And by treating those restrictions in the visceral pelvic organs, often the musculoskeletal problems disappear. That was the motivation for the author of the study to do and talk about this topic. Therefore, the objective of the study was to determine whether visceral manipulations and treatment of the bladder and the rectum has positive influence on musculoskeletal problems of the hip, namely external rotation lesions of the hip. This study was conducted with a quantitative quasi-experimental design. One group pre- and post-test design intervention study testing 26 adults with a mean age of 29 years of age. The author of the study tested 15 women and 11 men with absolute axis universal goniometer. The author of the study used two testing methods to test the internal rotation mobility of the hip. He used a test inspired by Peters and Layson, and he used a test described by Clarkson and Cipriani. The table on the right is an overview of the participants, their age, gender, the site of lesions, and the two tests of mobility of the hip before and after the interventions. The table on the right is an overview of the lesions the author of the study found while examining the participants. Only those lesions were treated afterwards. Before the interventions, all patients were examined for possible pelvic visceral lesions, pelvic skeletal lesions, and lumbar lesions. patients were only treated for their current lesions. The author of the study used 9 techniques very well described and accepted in the osteopathy profession. They are described by Viseral, Hapgen, Peters and Leysens and Hartman. Those figures and tables shows the measurements before and after interventions. The figure and the table on the left shows a strong significant difference in measurements with the hip in 90 degrees position after interventions, with a p-value of 0.000. The mean range of internal rotation motion was improved by 14.19 degrees. The figure and table on the right shows also a strong significant difference in measurements with hip in neutral position after the interventions, also with a p-value of 0.000. The mean range of internal rotation motion was improved with 10.69 degrees. Despite the study design had a high degree of viability and acceptability, this study had several biases. There were high risk of biases due to the absence of a control group. This study also had a big variation in the composition of the study group, as there were both female and male participants with age group between 18 and 50 years old. The reliability of the trial and the study can also be affected as only one person, the author of the study, both did the test and the interventions. The validity of the study would also have increased with a greater number of subjects. The study only investigated immediately effects of the interventions. Long-term effects were not considered, why reliability of the results of the study may not be accurate and useful in terms of practical therapeutic value. The results of the study relied upon 2 tests for the internal rotation mobility of the hip. The author of the study had to modify procedure of Peters and Leysens tests for the objective to make it suitable for goniometer measurements. This can be a bias as a good reference standard of tests are essential. This study examined the effects of osteopathic visceral treatment of the bladder and rectum in patients with restricted internal rotation mobility of the hip. The author used manipulative therapy for the parasympathetic and the orthosympathetic segments of the bladder and rectum to neutralize the viscerosomatic reflexes. Therefore, results of the study can not only be achieved by osteopathic visceral treatment but also with manipulative therapy that can affect the results of the study. The author of the study suggests that a new study would be done with a stronger design. Suggestions would be a randomized, controlled, double-blinded study with a test group and a placebo group, with a greater population group of patients. There should be 2 therapists with standardized protocols for how to perform the test and treatments. This would increase the validity and make the results more reliable. The study has shown strong statistically significant difference in internal rotation mobility before and after the osteopathic visceral interventions, with p-value of 0.0000. The study results can conclude with statistically significant that the osteopathic Viseral treatment increases internal rotation mobility of the hip. However, long-term effects were not investigated. Furthermore, results of the study needs an additional investigation about this topic with a stronger study design.